Hi, this is Dave Walsh, the owner of Revive Personal and Sports Training Fitness Studio, located at 251 Morris Ave, Suite 1B in Springfield, New Jersey. Today we are coming to you with week 12 of our weekly home exercise video demonstration. Today we are going to be talking about knee rehabilitation training after injuries occur, or hopefully being able to prevent injuries from occurring. Okay, before we get started, just keep in mind, if you have a serious knee injury or you've had a knee surgery where you would need to see an orthopedist and a physical therapist, I would get a medical clearance form from your orthopedist, and I also would collaborate very closely with your physical therapist. Once you set up the program, once the physical therapist sets up the program from the orthopedist's recommendations, I will collaborate very closely with both of them to make sure that we are doing the program successfully and working in unison together as a team. That's the key. Okay, so the progression of the program works exactly the way that the orthopedist and the physical therapist wants it. So this way we're working together as a team. That's a critical piece. Okay, so in terms of the knee, if anybody has had a ligament damage, cartilage damage, arthritis, osteoarthritis, these are basic injuries that occur with the knee. So that being said, what we want to do is we want to strengthen the muscles around the knee joint. Okay, so the muscles around the knee joint, the quadriceps, we have the vastus lateralis, vastus medialis, vastus intermedius, and we have the rectus femoris in the anterior part. Posterior part, we have the hamstrings, we have the semimembranosus, semitendinosus, biceps femoris. We spoke about these two before. We have the hip abductors, outer part of the leg. We have the hip external rotators. We have the hip adductors, inner part of the leg. And also the lower leg, we have the anterior tibialis, which is the anterior part of the shin. We have the gastrocnemius and the soleus, which are the calf muscles. Okay, so those are all the different muscle parts of the lower leg that we're going to try to be strengthening and also stretching to decrease injuries from occurring, and also if you have had an injury, to help you rehabilitate as quickly as you can. Okay, so our modalities today, we have a pro stretch, which I'll get to later, that we have at Revive. We have a foam block, which we'll be using in a little while. We have a foam roller. We have ankle weights that go up to 5 pounds. Okay, 2 ankle weights, 5 pounds each, which would be 10 pounds, obviously, 5 on each leg. We have a massager, which is right here, which I'll explain a little bit as we get moving through the demonstration today. We also have a resistance band. Okay, this goes on your ankle, above your ankles or above your knees. Okay, this color here is medium. Okay, there's different colors, light all the way up to heavy. Okay, medium is the most basic one to use, so I have that today. And we also have some foam blocks, which I'll explain to you. Okay, so what we're going to do first is we're going to have you use your towel. We're going to get onto the floor, and we're going to do what we call straight leg raises. Okay, we're going to grab our 5-pound weight. In your left, above your left foot. Okay, so straight leg raises are going to work those 4 quadricep muscles we spoke of before. Okay, so you're going to lie back down. The opposite knee is going to be bent up to protect the lower back. Left leg is going to be straight, point the toe straight up to the ceiling. You're going to lie on your back, arms to the sides. You're going to come straight up, hold for 1 second, come right back down. Okay, up, hold, back down. Try not to touch the floor. You're going to bring the left leg parallel, left knee parallel to the right knee. 20 reps on each leg, okay? If your injured leg, you could do 2 sets on the injured one, 1 set on the non-injured one if time is an issue. If not, it's always good if you can do 2 sets of each. That would be great. Okay, point the toe to you. 20 reps, breathe out when you go up. Flex that toe to you. Okay? Again, works the quadriceps, straight leg raises. Okay, the next one, we're going to bring our foam block into it. Okay? That's going to go underneath the left knee. We'll bring our foam roller. Okay, this is exactly the same one we use at Revive. You're going to bend that knee up. Okay, this is called the short arc quad set. Again, you're working those quadricep muscles we spoke of before. Working those muscles around the knee joint. So again, you're going to bend the right leg, point the left toe to the ceiling, lie back down, supine, arms on the hips, come straight up, right back down. Okay? You want to breathe out when you go up, get that straight, bring that lower leg straight up, exhale as you go up. Okay? Again, 20 reps left, 20 right. If you can do 2 sets on each, that would be great. The injured one, you can do an extra set. Obviously, you're going to want to work that more than the non-injured one. Okay? So those are the quad sets. Short arc quads, I should say. Okay, so now we did the quadriceps. We're going to lie sideways. We're going to do side lying hip abductions. Okay, so the way this works is you can go on your right elbow. If you have any shoulder issues, you could lie down sideways like this and rest your head on your arm. If not, you can go up, bend the inner leg, okay? Point this toe to you, left arm on the hip, straight up. Okay, come up. Again, hold for 1 second. Breathe out when you go up. Keep your leg nice and straight. Point the toe inward, okay? Side lying hip abduction, okay? Abduction means outer part of the leg, okay? So keeping with the ankle weight lying on your side, you can bring this up above the knee. And these are going to be what we call clamshells. Okay, this is hip external rotation. Okay, you can also put a band, the red band I spoke of before, above the knee. So the way this works is, again, left arm on your hip. You're going to come straight up and right back down. 1 second hold at the top. Breathe out when you go up, okay? You're working the external rotators of the hips. Very important for knee stabilization. So as you can see, again, 20 reps. We're trying to work all the muscles around that knee joint, okay? So keeping with that, we can take our weights off. And we're going to grab our pillow. Okay, lying on your back. We'll put the pillow in between your legs. Okay, these are going to be bridges with adductions. So we did the abductions, now we're going to do the adductions. Double D toward the knee. So remember, adduction, inner thigh. Okay, lie back down, supine, lift, squeeze, back down. Up, squeeze, back down. Okay, very easy, very effective. 20 reps, make sure the pillow stays in between your legs. In advancement to that, you can go single leg bridges. Okay, right down, left up, point the toe to you, step through that heel, try to bring the buttocks right up to the ceiling. Okay, this is obviously harder. As you get progressing through your knee rehabilitation, you can work up to this. Same thing, left side, 20 reps. Okay, have the buttocks tap the floor, explode right back up. Okay, now we can have you get back up. Now we're going to put the band we spoke of before